is an ABG checkoff. Before I enter the room, I'm going to check the physician's orders. Also, I will check any other information like the patient's temperature if it was currently taken. That way I can put it on the label. I'm going to knock, sanitize, glove. Hi, Mr. Smith. I'm Tiffany. I'm a respiratory care student. Dr. Johnson ordered a blood gas today, so I just need to get a little bit of blood from your radial artery in your wrist. Can I get your name and date of birth? Okay. Are you left-handed or right-handed? You're right-handed. I'm going to look at your left arm here. Just going to put a little bit of pressure on your ulnar and your radial artery at the same time. And if I could have you make a fist and open it and close it just a few times for me. Perfect. When I release the radial artery, the palm of the hand should flush in 3 to 5 seconds. If not, I would repeat the test on the other arm. And I can prop the hand up on a towel as well. All right. And feel just a little bit of a poke here. And I go in between the second and third fold in the wrist. Blood should automatically retract into the syringe. If not, pull back and adjust a little bit without taking the needle out. All right, can I have you hold pressure to that for me, Mr. Smith? Now, Mr. Smith is not on any anticoagulants. I would hold it pressure for about 5 minutes. If Mr. Smith was on anticoagulants, I would hold pressure for about 10 minutes or longer. All right, Mr. Smith, I want you to keep that Band-Aid on your wrist for about 4 hours so we don't get any sort of infection in there. If there's any bubbles in the syringe, you can tap it so they go to the top, and you can push them up. On my patient label, I'm going to put the patient's name, date of birth, the time the sample was taken, my initials, the patient's temperature, the patient's FiO2, the site that it was drawn from, and I'm going to attach that all to the label. Biohazard bag it, and I'm going to send it off to the lab immediately. If not, I would put it on ice, put my needle in my sharps container, clean up my room, and thank the patient and chart.